Hi guys, welcome. So, first things first, little housekeeping. Making sure everyone saw the change. There is a mandatory posting board now. Um, there is 5 questions, I think it is. This is take place of the writing assignment that the deadline flew by and nobody, including me, noticed. Um, Otherwise, I would have reminded you a little bit more, but I think this works out better anyway because then we don't have to worry about getting paper copies to anyone, printing things out, stuff like that. So far, I have set the due date to April 20th, so you still have a couple more weeks to get on there and answer those questions. It's pretty easy stuff, but the point of this is I want you to treat it like a real paper. Um, for a lot of you guys, your education does not stop here, and we need to make sure that you are prepared and can write articulately and make sure that we have those skills, and if not, get you the resources to build those skills. So hopefully everyone's seen that and either commented on it or is thinking about their answers or preparing. I'm going to try and get through as much as I can today. I'm going to try and get through chapters 11 and 12. Don't know if it's going to happen or not, but I'm going to try to. Um, Chapter 11 is the chapter regarding gender, sex, and sexuality. So, that being said, there's something, obviously, this is kind of a hot button topic. Now, transgender and asexual, there are a lot more evolving terms now than there used to be. So, one thing that we want to do in this class is raise awareness to those changes and talk about what those changes mean. What do these terms actually mean? How does this affect you? Um, and try and prepare you guys for that because this is becoming a very large part of our society. And, we want to make sure that we treat everyone with respect and understanding the best we can. So, with that said, what is the difference between sex, gender, and sexuality? Sex is your biology. So, whatever reproductive organs you have been born with. Um, Now, in today's age, those can change with surgery and hormones and things like that. But your sex is generally your biological reproductive parts. Um, Sex is, by the definition of the book, the properties of a person that determine his or her classification as male or female. So, again, the way I prefer to understand it, and for testing purposes, I think this definition is a little bit clearer. Your biology, your biological assignment. So, the next definition is gender, which is your scale of masculinity or femininity. So, how masculine or feminine a person is. And gender is a psychosocial construct. So, what that means is it is your mind and how the world treats you and how those things fit together. And obviously, sex is a huge part of this as well. Because what happens when your born sex, your biological components, do not match your um, identity of how male or female you are? And it causes really big issues. We're going to talk about gender dysphoria here in a little bit. But it's in the DSM, it is an actual diagnosis, and that's why these terms and these concepts have been evolving because, we are realizing that they have a much larger impact than we once originally gave them credit for. So kudos to the world of psychology for recognizing that and preparing for that. Um, so there are some more terms in here talking about sex chromosomes, gonads. I'm not gonna get too complicated with that. Definitely not gonna test too much on that. Understanding that testosterone is by and large the male sex hormone, and that estrogen and progesterone are the female hormonal components, and then gonads being, um, the biological components that produce these hormones. So, Understanding that is important, but for assessment purposes, that is probably as deep as it is going to get. Secondary sex characteristics we are going to talk about. So, obviously, when you hit puberty, there are a lot of changes that happen to your body. But one of those is secondary sex characteristics. So, obviously, your primary sex characteristics are going to be your sexual organs, but there's more to it than that, too. And a lot of that comes with hair production in places that you are unfamiliar with. And for women, it is the growth of breasts, things like that. Traits that differ between the two sexes but are not part of the reproductive system. They include breasts in females and facial hair in males. So, understanding those things are secondary sex characteristics, basically things that change whenever you hit puberty. Gender, we already talked a little bit about. Gender identity, an individual's multifaceted sense of belonging to the male or female sex. So, the world as you understand it, what it means to be male, what it means to be female, and where you fit in that equation. So, hopefully, that makes a little bit more sense. Androgyny. Androgyny is another kind of bigger deal that has been brought to the limelight as of late. So, talking about having both male and female characteristics. A lot of times people think of this as kind of gender bending, which is not really an accurate representation of this. With androgyny, it is going to be somebody that has, again, both male and female characteristics. So one of the things that they put in there was a picture of Lady Gaga, because Lady Gaga does like to wear suits and has a very empowered wardrobe and chooses male articles of clothing sometimes in order to represent that side of her, that powerful kind of side of her. And that goes along with gender stereotypes, which we'll talk about here in a little bit. But obviously she does this while still wearing makeup and, still having long hair. So she has that kind of blend. Another kind of more inherently natural kind of representation of that, I think, is Ruby Rose. She does have some very feminine qualities, but then she does also choose to kind of engage in some behavior or kind of have some male characteristics like the short kind of chopped hair. So, it's kind of that whole looking at someone and wait, and kind of that second look, I guess, that kind of goes along with that. And that's what androgyny is again the presence of both male and female characteristics. Um, so the book did a really good job of this. With the disorders of sexual development, they did a really good job of this. They talked about a really important study, and I was really glad that they kind of brought it up, the whole John Jones study. So basically, what happened was you had two male twins that were born, one of which had a botched circumcision. So one of the things that they looked at, or one of the possibilities for treatment, was transforming the male genitalia into female genitalia and raising the child as a female. And it talked a lot about the consequences of that and what happened as a result of that. Kind of going back, and I know I summarized it in one of the PowerPoints, but to talk specifically or quote from the PowerPoints, not to mention just, keep track of where we are. So, sex properties of a person determine the classification of male or female. Sex is a biological determinant. Which sexual organs do they possess? Gender. Psycho and social aspects of being male or female. Again, a psychosocial construct includes how someone thinks or feels. And gender identity, if somebody identifies as male or female. Definition. Like I said, I included this in the PowerPoint just because I thought it was a clear definition, and that is some kind of definitions that previous texts have used just to kind of emphasize that. Again, androgyny having characteristics of both male or female. So, yeah, talking about the John Jones study on 359. Talks too about another study that actually looked at it. Was a case study of that particular case. Um, I did some more research on this as well, kind of looking back into that. Um, but it was really interesting, and it is kind of a hallmark case in terms of sex and gender. So please look into that. Make sure you have a clear understanding of that, because I may very well test on that, um, just because it is so important. But talking about money and diamonds, how funny is that? Money and diamond. Anyway, um, so going along with that. All right. So, like I said, oh, and I put on the PowerPoint, read it, know it well, because, like I said, I am likely to test on it. Um, Talking about transgender. Um, so, this is what I was talking about earlier, where your biology does not match your gender identity. Um, so, one's gender or one psychosocial gender, one psychological gender, and differing from the biological components. It is more prevalent in MTF, which is male to female, more so common than in females who identify as male. Um, so more males are more likely to feel like they're female, or in a, psychologically feel like a female and have male reproductive parts, including testes and penis, than the other way around, than for women to feel like they were men. So, um, they've also kind of changed the semantics of what goes along with that. It's now called gender reaffirming surgery. So understand that whenever we say that, we are still talking about gender reassignment surgery. And the reason why they did that is because you are changing the biology to fit one's gender, one's mental state, one's psychosocial identity. So, it really goes back to this idea of people feeling this way, that this isn't right. My biology does not make sense. The same way that we would with, any other disorder, diabetes, cancer, and things like that. Whenever you're sick, your body gives you signs and hints and clues. And so, this concept of gender reaffirming surgery goes along with that and says, hey, my body doesn't feel natural, something doesn't feel right. And having a medical intervention to make that work and to make those factors match. Social cognitive approach. I put in here a 60 minutes video, and it is older, I know, but it is a really great example. And it talks about social cognitive approaches, which is this idea that inherently children want to please their parents. So, whenever a boy, and I'm being very stereotypical here whenever I do this, but whenever a male child plays with a girl's toy and dad sees it, and dad kind of has that freak out of, what are you doing? You're playing with a girl's toy. That socially, the child recognizes, oh no, I've done something to displease my parent. I have to change that. So, they are more likely to play with male gendered toys because they know it's what pleases the parent. Um, so the implication that the displeasure of a parent when a child plays with a gender non-conforming toy, so a girl playing or a boy playing dress up and putting on heels, is noticed by the child, that they change their behavior in order to please the parent. And the video that I put up from 60 Minutes is actually somewhat opposite of that, in that the mom has kind of gone along with what the son wants to do. So the son is very into My Little Pony and flowers and girls and Bratz dolls and stuff like that. And mom realized it and has gone along with it. Um, and it does really show a contrast between the male twin that is very dominant and kind of typically male gendered versus how his brother reacts. So that's pretty interesting. Please do watch that video. Um, Evolutionary theory emphasizes the physical differences between men and women and frames them in terms of survival and reproduction. So, again, evolutionary theory, I feel like I say this every week, but going along with propagating the species and continuing the bloodline. Um, so, the women have the characteristics that they do in order to nurture children and keep that bloodline going, whereas men tend to be the protectors, is by typical male gender stereotypes. And the distance that they often exhibit is a protective factor to keep their family safe. Um, Social role theory examines how these differences influence our expectations of certain genders. So, a lot of times, maybe seeing a male or a female who is more pugnacious or more kind of picking fights, more protective in a physical way, or kind of more cavalier, I guess. Social role theory, um, that kind of contradicts that. So, I'm not going to test on that one, by the way, just so you know. Just kind of threw that in there so that you knew. Gender roles. Roles that reflect an individual's expectation for how a male or female person should conduct themselves, how they should think, look, act, things like that. Um, Going along with the book, there's kind of disparity. I didn't really talk about sexual selection in there, so don't worry about that. Social cognitive approaches, covered that. Social role theory. Um, Gender roles reflect the individual's expectation for how a male or female person should think, act, and feel. So, whenever you see me, what do you expect? Um, you know, the kind of expectation that I would feel more or express feelings more than a male. That and we do. We have expectations about how we think a male and a female should think and act and present themselves. Um, so, um, Gender stereotypes, overly general beliefs about and expectations about what men and women are like. We see it all the time with like Facebook. There are memes all the time that it's like, when I ask her what she wants to eat, or um, you know, when a girl posts on my page, who's this? This kind of stereotype that women are always on edge and kind of vigilant, thinking that people are cheating or that they can't make up their mind or that we emotionally overreact. All of these things are gender stereotypes. Versus, we have them for males too. That it's like, oh, when I ask him to go on a date and then, like him sitting there playing video games. This kind of gender stereotype that men are going to ignore women. Um, which stereotypes exist for a reason. These things all come from some little bit of truth. Is it exaggerated? Absolutely. So keep that in mind whenever you think about that. Um, let's see. Feelings. So, a little bit of background. I think I've kind of told you guys, but if not, gonna tell you now. Um, Went through the mental health counseling program over at FSU. That's what my degree is in. That's why I get to teach you guys. Um, and empathy is a huge part of that. Empathy is your ability to understand the feelings of someone else, not feel them for them, but understand how they would feel. What's the difference? Your ability to put yourself in their shoes. So, imagining how someone would feel in that situation. So, for example, if you have somebody that has had a death in the family, well, if your brother or sister or if your parent died, how would you feel? You know, unless you've had it happen to you, you don't know how you'd feel. You can guess, and you're probably right that you would be heartbroken and that you would be sad, but you know, you don't know until it happens to you. So all you can do is try and put yourself in their place and say, if this happened to me, I would feel blank. Um, so, you know, your boyfriend or your girlfriend cheated on you. Maybe that's something that happens to your friend. So you can empathize that, oh my God, I'd be furious. Like, I hate them. I am so sorry. Like, that sucks. Like, and I kind of contradicted myself there, but sympathy is the feeling sorry for someone. The wow, it sucks to be you. I'm sorry. The kind of remorseful kind of thing, whereas empathy is more imaginative, and that you get to put yourself in their shoes and imagine how they would feel. And hopefully that distinction is clear. If not, let me know. So, and we'll talk about that some more. Um, Aggression. So, talking about gender differences whenever it comes to aggression. Again, I'm being very stereotypical here, but we are working off of generalizations. As a whole, they handle aggression much differently. Males tend to lean more towards physical aggression. Why? Evolutionary differences. Um, they are stronger. And not to say that a woman cannot adapt and overcome to reach that, but that naturally males have an inclination towards that, and that they don't have to work as hard to do that. Whereas women, again, tend to have more verbal skills. Does that mean that all women have better diction and speak more eloquently and are more articulate? No. It means that they have a natural inclination to be successful as that, and that oftentimes, in order for a male to reach that level of linguistic superiority, they have to practice it, or kind of overcome that. It's not a naturally given thing. So, um, physical aggression, um, or overt aggression, um, is what they call it. Overt aggression is physically or verbally harming someone directly. I swear I can talk. Um, but attacking someone directly and not hiding it, not giving someone a piece of your mind, or physically fighting someone. That's overt aggression. And again, stereotypically, that is more associated with males. Relational aggression is behavior that is meant to kind of harm the social standing of another person. So, a lot of times this will include generating rumors and lies. Another really good example of relational aggression is the silent treatment. Um, you know, Not talking to someone or ignoring them. You're not physically hurting them, and you are not directly doing it, but you are making their lives more difficult in how you treat them. So, hopefully that is clear. Um, Going on along with that, sexuality. So we talked about how the chapter is sex, gender, and sexuality. Kind of talked about sex and gender and the difference between those. Again, one being biological, one being psychosocial. But what sexuality is the way people experience and express themselves as sexual beings. So part of that is going to include thoughts, beliefs, attitudes, sexual preferences, and sexual orientation, because that influences who you are attracted to. And that's part of sexuality. Sexual attraction, or sexual orientation, I'm sorry, the direction of an individual's erotic interest or romantic interests. It's on page 374. So, whoever you are romantically or sexually attracted to, be it same sex, opposite sex, or bisexual, either one, preference for either. So, heterosexuals, where individuals are generally attracted to members of the opposite sex. Homosexuals, or homosexual, when individuals are generally attracted to members of the same sex. And bisexual, when they are attracted to either sex. Sexual response cycle. I'm not gonna lie, I love teaching this in person. I kind of wish I could do that with you guys, because everybody gets so visibly uncomfortable. Joss is about to say orgasm. Oh no! This is something that actually happens in the classroom. Even though we're all adults, this is something that still happens. So, there is a cycle or a pattern of things that happen during sex and sexual activity. The first being the excitement phase. This is resulting in muscle tension, respiration rates, heart rate, blood pressure increase. There's also something called vasocongestion, which is what leads to an erection. So when the blood rushes through the penis, resulting in an erection, or whenever the blood rushes to the clitoris to swell and lubricate in preparation for sex or sexual activity. And that's the excitement phase. Your plateau phase is when the excitement builds, but at a slower pace. Don't know if any of you guys have seen it, but Glee had kind of a funny one with that, where Finn was trying to kind of prolong this stage. He was having sex with his girlfriend and, didn't want to climax too easily. He was trying to stay in that plateau phase longer. Super uncomfortable to talk about, right? Totally a thing though. But it talked about how to prolong that muscle tension or the actual orgasm part, which results in the orgasm phase, when sexual arousal has reached its peak intensity and is discharged in a series of muscular contractions that pulsate through the pelvic area. I'm not giving you anything other than a textbook definition for that. So hopefully that's clear. I'm joking, but in all seriousness, if you have questions, let me know. But the book does a really good job of breaking this down and putting it in pretty easy to understand, straightforward terms. And then the resolution phase, where physiological symptoms of arousal subside. This results in something called a refractory period in men, where they are no longer responsive to sexual stimuli. And yeah, that's the resolution phase. Sexual difficulties. I'm not gonna lie, this is really been doing this for 3 years now. This is the most in-depth that I've had a text go with this. If you look back to on page 374, I know it was a couple slides back. Excuse me, but on slide 11 where it talks about sexuality and sexual orientations, that's on page 374. So if you need that, by all means, check that out. It does talk a lot about gay and lesbian functioning. Again, this is to kind of accommodate and kind of familiarize the world with current events and things that have changed, because once upon a time, you would have never seen this in a textbook. So the fact that we are putting it out there and we're like, hey, this is what's changed and this is what's progressed. I think that's really cool. Page 382. If you do have more questions on the human sexual response pattern, that's where you can find that. And now our current slide. So we're on slide 13, page 385. So a fetish. Object or activity that arouses sexual interest or desire. So kind of joked about foot fetishes in some movies and stuff like that. It does talk about transvestic fetishism, which whenever we talk about psychological disorders, this is kind of what we use as an example. Not that it is a sexual disorder, but what it talks about is the 3Ds. So it talks about if something is deviant, so is it normal? For those of you that don't know, transvestic fetishism is somebody who is erotically aroused by somebody who dresses as the opposite sex. So, say you have a male-female relationship, but that the female really enjoys when the male dresses as a female. Is that normal or is it typical? I hate the word normal. Is it typical? Is it something that you would expect? No. Is it deviant? Which there's kind of a negative connotation with deviant to think that it's bad, but again, kind of what you're looking at is it typical? No. Is it maladaptive? Maybe. Depends on the frequency and if it's, if there's kind of something to overcome or if they're compensating for something, and then distressing. So, which, may or may not be distressing for some people. But the book talks about transvestic fetishism and kind of talks about that. Um, so fetish, something that is basically sexually arousing or pleasing for someone, be it an object or an activity. Um, Saw where a woman had married a chandelier. Um, I can't say I understand it, but maybe there's some sort of fetish there. I don't know. Um, so kind of what that is. Um, Let me see. Making sure I'm not forgetting anything else here. I think that's pretty much it. Um, Paraphilia is uncommon sexual acts. And actually, um, 386 has a pretty good graph about that. So, sexual disorders that feature recurrent sexually arousing fantasies, urges, or behavior involving non human objects, the suffering and humiliation of another, or children or non consenting individuals. So, this is where we start getting uncomfortable. But it does have a list of some of those. So, exhibitionistic disorder, people who like to have or kind of get off by having sex in public places or exposing themselves to others. Um, let's see. Um, Talking about also voyeuristic disorder. So, enjoying watching someone or observing someone without their consent. Um, Obviously, most of these are illegal and have an aspect of them that is criminal. Because, again, a definition. So, sadomasochism, 50 Shades of Grey stuff, um, that has become more mainstream and more talked about. But whenever you start talking about um, non humans or necrophilia, things like that, obviously most of this is very, very um, illegal or taboo because you're infringing upon the rights of others. Remember, we talked about Freud. We talked about his kind of obsession with sexual impulses. Um, his thing was that, um, kind of going along with that, that this is what society mandates and what society dictates more than anything else. Because, again, rights of others. We manage violent behavior, we manage sexual behavior um, because we have to maintain the rights of other individuals. And that's why he was so preoccupied by those two in particular examples, because that is what society manages or dictates more than anything else. So now that that bit of discomfort is over, um, STIs, sexually transmitted infections. I learned an interesting statistic last night watching The Good Doctor. 25% of college students will be diagnosed with some sort of sexually transmitted, they use the word disease, the book uses infection, but 25% of college students will be diagnosed with some sort of STI before they graduate. That's a really scary statistic. Um, so obviously it talks about AIDS, it talks about HIV. Um, it doesn't really mention a whole lot about chlamydia or gonorrhea or any of the other ones, which can be treated, but are still very frequently and commonly found in college populations. So that's something to keep in mind. And I'm your teacher. You do you, but please do it safely. Um, so, and again, that's page 388. That is it for chapter 11. Um, Hopefully that helps. Again, I know there's some kind of stuff in here that's uncomfortable to talk about, but this is how we empower ourselves. We talk about it and we get all of the myths, clear the air of all of the fallacies in order to have accurate information and be mature, responsible adults and individuals in order to keep us going. So, hope that helps. Hope everyone is doing well. Again, if you need anything, please let me know. But like I said, I went ahead and extended all the quiz deadlines. And you can always turn things in late. Um, Better late than never. So I know I've been running behind and I apologize. This should not have taken this long to do, but we're getting there and, just trying to keep everything on pace as much as I can and stay on schedule as much as possible for your success and mine. So hopefully that shows and all is well. Again, please do comment on the mandatory discussion board, and if you need me, please let me know. Thanks.